So this article is about Careful Devices, which is a design-led research project that hopes to integrate a practice of healthcare that is centered on a user's experience and judgment rather than medical definitions used by physicians. This project is at the intersection of consumer technologies that track a user's data, like how many steps they do in a day or their sleeping patterns, and contemporary medical practices like telehealth that allow patients to receive at-home care. The article also describes design limitations in terms of use, aesthetics, and travel. And essentially, a design should be accessible, easy to use, and allow data to travel between user and physician so that it can be understood by both people. And a challenge that arrives is in terms of use is when a data produced from self-tracking and reporting is solely used to deduce a person's condition. Even without the person whose data is being used isn't consulted, then it could result in a faulty self-diagnosis that tends to happen when you Google your symptoms. This challenge can be resolved if the design of a product includes a user's experience and judgment, not just the information from self-tracking.
Looking into an example of a careful device, Ovum is an ovulation tracking device for couples that are trying to have a baby. Fertility can be a burdensome and intensive process because of all the amount of data and knowledge that needs to be known. Some of this can include the menstrual cycle, hormones, body temperature, electrolytes, and other health data. Ovum tracks the saliva and is able to magnify and illuminate the sample for people to interpret how the body's fertility is doing. This projection can be seen by both people who are involved in the process of conception and can involve both the emotional, relationship, and sensual experiences. Ultimately, health devices should be designed as a balance between people who are living and experiencing it as well as the medical knowledge that's necessary. By providing different perspectives, people are allowed to participate more in their own care and get more involved. In my opinion, I think this is a really great thing because a lot of health problems can be very emotional, but equipping people with the correct knowledge will allow them to be invested within the process.
I definitely think that the design manifesto for Careful Devices is going to be useful for patients. I think the idea that patients inputting different aspects of their health in terms of being able then to understand what the input means and basically then make decisions from there. I do think that will be really useful. One thing though that I think was not discussed enough though about the challenges is how much pressure this puts on the patient. And although it is nice for a patient to be able to track their health in their own private space, I also think it does add a new layer of stress in terms of the person wanting to validate what they're putting in. And I think that's something that's going to be difficult when you're at home alone and you can't ask people questions.
The All of Us research program is a nationwide research initiative which means to take advantage of improving technological and informational systems. By gathering the electronic health records of hundreds of thousands of Americans from diverse communities across the country, All of Us intends to create a robust data platform to support a wide range of health studies. Participants can contribute information from a variety of sources, from lab results to data gathered from Fitbits or other personal health monitoring devices. This data will then be accessible by researchers who intend to use it to further their own medical studies. With enrollment being open to the public, the program intends to gather the data of a large and diverse portion of the American population in order to get the most representative data possible. The authors expect that the resource will become more and more valuable as more data is gathered.
The All of Us research program is a historic effort to gather data from 1 million or more people living in the United States to accelerate research and medical breakthroughs, enabling individualized prevention, treatment, and care for all of us. By taking into account individual differences in lifestyle, environment, and biology, researchers will uncover paths toward delivering precision medicine. What's following through Americans' veins, it is diversity and it's those very differences that will lead to answers for generations to come. At the moment, healthcare is often one-size-fits-all, but imagine a future where your healthcare is tailored to you. We want to make sure that the future possible by creating a resource that allows researchers to conduct thousands of studies on health and disease.